Presentation that you have.
Muy bien, muchas gracias. Una pregunta. ¿No cuestión?
Thanks a lot. If there are no questions,
Entonces me voy a hacer yo una pregunta.
so I will ask you questions.
¿Por qué dejar de fumar?
Why should we stop smoking?
La humanidad, en toda su historia, no ha conocido una pandemia tan brutal como es el tabaquismo.
Humanity in all its history hasn't known any pandemic as terrible as smoking.
Por año, quienes consumen tabaco mueren en una cantidad superior a lo que mataron las dos guerras mundiales del siglo XX.
Every year, people consuming tobacco have a higher mortality rate than all the people that died during the two world wars together.
Más de 8 millones de muertes por año debidas al consumo de tabaco.
More than 8 million deaths per year because of the consumption of tobacco.
Desde que ingresé hace 2 horas y poco a este recinto, a este momento, en el mundo han muerto más de 100.000 personas por fumar.
Since I've come to this venue about a little less than 2 hours ago, more than 100,000 people have died because of tobacco consumption.
No solo por cáncer de pulmón, sino por otros tipos de cánceres,
Not only because of lung cancer, but also other kinds of cancer.
cáncer de laringe, de garganta, de tráquea,
Larynx cancer, trachea cancer, throat cancer,
y cánceres que están fuera del aparato respiratorio.
and also cancers that are not in the respiratory part.
Por ejemplo, cáncer de vejiga.
For instance, bladder cancer.
Los productos químicos que tiene el humo de tabaco, más de 500 de ellos son cancerígenos, se disuelven en la saliva, se concentran en los riñones y se eliminan por vía urinaria e impactan sobre la vejiga produciendo cáncer de vejiga.
Many of the chemicals contained in tobacco that are cancerogenous are expelled through the urinary system, and they cause bladder cancer.
Y este agente cancerígeno no respeta género, ataca tanto al hombre como a la mujer.
And this cancer-provoking chemicals, this substance, these agents, they cause cancer in men and women.
Y además de los cánceres, produce enfermedades cardiovasculares,
They don't not only cause cancer, but also cardiovascular diseases,
infarto de miocardio,
myocardial infarct,
accidentes cerebrovasculares,
ictus, strokes,
enfermedades pulmonares obstructivas crónicas,
chronic pulmonary diseases, lung diseases,
etcétera, etcétera.
and so on.
Por tanto, creemos que es tarea no solo de los científicos médicos, no solo de la academia, sino también de todos luchar contra esta pandemia brutal que tiene el mundo.
That's why we think it's all our task, all our mission, not only our scientists, medical doctors, academia, but everybody together, we have to fight this pandemic together.
Los gobiernos tenemos la obligación de trabajar fuerte para informar, para educar a la población en el daño que produce el tabaco.
We governments have the obligation to inform and educate our people about the harm tobacco causes.
Organizaciones no gubernamentales
Also NGOs
y fundamentalmente los medios de comunicación masivos.
and mainly mass media also have this task.
Una pantalla de televisión una audición radial, un medio escrito que informe a la población, que le dé elementos para defenderse con esta pandemia, pueden ser mucho más importantes que una sala de operaciones, que un acelerador lineal o que un producto de tratamiento químico de cáncer.
A TV screen, a radio transmission, a written article can have a much stronger, much more powerful impact than what is being done in the surgery room.
Ustedes, los medios de comunicación, son una herramienta fundamental en esta lucha que debe liberar la humanidad en su conjunto.
You, the media, are playing an essential role in overcoming this pandemic that is scourging humanity.
Hay material informativo que ha editado la Organización Mundial de la Salud y que ustedes pueden tomar como guía para desarrollar programas educativos y de promoción de salud.
There is information material that was issued by the WHO that can be used as guidelines for everybody to draw up education and public health programs.
Y les puedo asegurar que van a sentir la misma enorme satisfacción que hemos sentido quienes estamos luchando hoy contra el tabaco cuando se vean los resultados positivos, que es defender el derecho a la salud y el derecho a la vida de nuestros pueblos.
And I can assure you that you will feel great satisfaction when you see the positive outcome of all your efforts in defending the right to health and to life.
Modestamente los invito a que trabajemos todos juntos en esta tarea.
So very modestly, I'd like to invite you all that we work together on this very important task.
Thank you so much for your attention.
Can I ask in Spanish? ¿Es okay?
Spanish.
Gracias. Tengo una pregunta. Usted mencionó, soy de la agencia EFE. Usted mencionó en su discurso que ha mejorado la imagen del Uruguay gracias a esta campaña. Mi pregunta es, ¿cuál es la recepción que usted tiene de otros mandatarios, otros presidentes, otros responsables en materia sanitaria de otros países frente a su iniciativa en Uruguay? ¿Por qué es tan difícil que otros países sigan el paso que ustedes han tomado? ¿Cuál es su opinión?
Yo diría que hay dos tiempos, dos periodos muy claros, muy definidos para responder a su pregunta. Uno, previo al laudo de la CIADI, del tribunal que laudó la disputa entre Philip Morris y Uruguay.
So the question was from a gentleman from EFE. So you mentioned in your speech before in the plenary, you mentioned that amongst other things, the image, the reputation of Uruguay on international level has been improved thanks to the tobacco control measures introduced by Uruguay. So what was the reaction from other mandatories, from other government officials, other heads of state? So why is it so difficult to implement the measures implemented in Uruguay in other countries? So the answer is, well, we have to see it in two stages. The first stage is the one previous to the decision of the International Center for Investment Dispute, for the settlement of investment disputes.
Como seguramente ustedes saben, el tribunal fue un tribunal del Banco Mundial. Y hasta que emitió el laudo, Philip Morris tomó a Uruguay como pequeño país y le hizo este pleito demandándolo por $300 millones, que era mucho dinero para el Uruguay.
As you know, the International Center was a tribunal, or is the tribunal from the World Bank. So before the decision, Philip Morris considered Uruguay being a small country, and they sued us for $300 million, which is a lot of money for a small country like Uruguay.
Philip Morris argumentaba que ellos habían sido lesionados en su derecho comercial.
So the argument of Philip Morris was that they had been violated in their commercial rights.
Y como había un tratado de protección bilateral de inversiones entre Suiza, donde está Philip Morris, y Uruguay, se basaban en ese tratado para demandar a Uruguay.
As there is a bilateral investment protection agreement between Switzerland and Uruguay, they said that that this agreement had been violated.
Lo que Philip Morris quería no era el mercado pequeñito de Uruguay para vender sus productos. Lo que Philip Morris quería escarmentar a Uruguay para que el resto de los países que pretendían llevar adelante el convenio marco de la Organización Mundial de la Salud no siguieran adelante en esa tarea. Escarmentando a Uruguay también introducían un factor de temor a otros países.
So what Philip Morris wanted was not to maintain the market and think about the small market in Uruguay, but it just wanted to pressurize Uruguay in order not to set a precedent for all the other countries that are signatories to the framework convention by the WHO. So they introduced this other factor of fear.
Ante esa situación, Uruguay en el pleito planteó que sobre el derecho comercial están los derechos humanos, el derecho a la salud y el derecho a la vida.
The argument by Uruguay in this lawsuit was that the prevalence of the right to life and to health is in front of the commercial right that was argued by Philip Morris.
Y el derecho soberano que tienen los países y los pueblos y los gobiernos de defender la salud de su gente sobre el interés comercial.
And it's the sovereign rights of states and countries to defend the health and life of their citizens, confronting it to the right, to commercial rights.
Y este tribunal, que estaba acostumbrado a actuar en pleitos comerciales entre privados, por primera vez tuvo que actuar en un pleito entre un privado que demandaba a un país.
This tribunal that was used to interfering in trade disputes between private companies and private companies. In this case, for the first time, it was between a company and the state.
Y este tribunal, en un laudo histórico que cambia la historia, laudó en favor de Uruguay en todos sus términos.
And this tribunal, in a historic precedent that really marks history, took a decision in favor of Uruguay.
Reconoció el derecho soberano del gobierno y del Uruguay a defender la salud de su gente.
It recognized the sovereignty of the Uruguayan government to protect the health of its people.
Y estableció claramente que sobre el derecho comercial está el derecho humano, el derecho a la vida, el derecho a la salud.
And it stated clearly that before the right to trade, there is the right to health and to life.
Y hoy en día se está estudiando a nivel internacional excluir de los tratados de protección bilateral de inversiones aquellas industrias o aquellos productos que sean dañinos para la salud de la gente.
And now on an international level, the possibilities is studied to exclude from bilateral investment agreements all industries and products that are harmful detrimental to the health of people.
No por obtener inversiones los países para poder desarrollarse, tienen que hacerlo o proteger las inversiones de industrias que dañan la salud de la población o que dañan también el medio ambiente.
In order to obtain investments to promote development in the country, you cannot protect investments from industry whose products harm the people.
Y Uruguay, modestamente, en la medida de sus posibilidades, seguirá aportando y trabajando fuertemente en esa dirección.
And Uruguay, with its modest possibilities, will continue working into this direction with all its effort.
Pero ¿cuál es el feedback que ustedes?
El feedback que recibí, lo recibí en la última Asamblea General de Naciones Unidas en septiembre, donde una cantidad importante de representantes de gobiernos, sobre todo latinoamericanos, se acercaron a felicitar a Uruguay por el logro que había obtenido y nos dijeron expresamente que estaban trabajando fuertemente para seguir ese camino que Uruguay había transitado. También recibimos, debo reconocerlo, el apoyo invalorable de la Organización Mundial de la Salud, de las personas que trabajan en el control, en la oficina de control del tabaco, para impulsar el control marco que tiene la OMS, de la OPS, de la Oficina Panamericana de la Salud, y de algunas instituciones como la Fundación Bloomberg, que apoyó enormemente al Uruguay en esta disputa.
So what was the feedback? Was the question? So for instance, during the last General Assembly of the United Nations in September, many government representatives approached me, and mainly from Latin America, and congratulated Uruguay for what it had achieved. And they said they would be working they would be working hard to follow the same path Uruguay had chosen. I'd also like to mention the invaluable support of WHO, particularly the Office for Tobacco Control, that is responsible for implementing the Frame Convention on Tobacco Control. Also, the support by OPS and by the Bloomberg Foundation that helped us to file this law, to stand up against this lawsuit.
Con ese laudo de la CIADI, el organismo arbitral, en julio de este año comenzó la segunda etapa a la que hacía referencia. Y es en esta etapa que estamos y a la que invitamos a todos ustedes, fundamentalmente a los medios de comunicación, por la importancia que tienen para difundir estos temas, para educar e informar a la población, que nos acompañen en esta lucha.
And after the decision ruled by the International Center on the Settlement of Investment Disputes in June, the second stage started that I mentioned before, so this two-stage approach. So the second stage is now where you, as media representatives of high importance, to fight the use of tobacco.
My name is Ilona Reuter from the Austrian
Soy Ilona Reuter, de la televisión austríaca.
I wanted to ask you what was your
Quería preguntarle cuál ha sido su motivación principal para implementar estas medidas severas. ¿Es porque usted es oncólogo o porque el número de personas que padecen de cáncer de pulmón en Uruguay? ¿Cuál ha sido la motivación? Y segunda pregunta, ¿cuáles son los resultados exactos? ¿Qué es lo que lograron en cuanto a números?
Ambas cosas me motivaron para actuar en esta dirección. Mi condición de médico oncólogo y mi responsabilidad como gobernante para proteger la salud de la población.
So because of my two conditions, first of all as an oncologist, but also as a person in government whose obligation is to protect the health of people.
Les puedo asegurar que la experiencia como médico de ver morir a una persona con un cáncer de pulmón encharcada en sus propias secreciones, con vómitos de sangre, y el sufrimiento del entorno familiar es realmente dramático.
I can assure you that as a medical doctor, having seen many patients die of lung cancer in their secretions, vomiting blood, seeing their family members suffer.
El sufrimiento es muy grande.
That's a very big suffering.
Y lo dramático es que el cáncer de pulmón prácticamente es incurable, se cura un 5, un 6% de los enfermos que tienen cáncer de pulmón, solamente un 5, un 6%.
And it's a very dramatic situation because lung cancer is practically incurable, so only about 5 to 6% can be cured.
Y ante esa realidad tan cruda está la otra, que por prevención no se contrae cáncer de pulmón si no se fuma.
So this, on the one hand, this is the crude reality, but then we also know that through prevention, by not smoking, we can prevent lung cancer.
El cáncer de pulmón, siendo evitable, no es curable.
Lung cancer that can be avoided at the same time cannot be cured.
Y esta es la lucha que tenemos. Este es el problema que tenemos que enfrentar. Que la población comprenda que si no fuma, es muy poco el riesgo que corre en tener un cáncer de pulmón.
That's the battle that we have to fight. That's the challenge that we have to overcome. If people start to understand that if they don't smoke, they won't die or they won't have...
y que si fuma, es muy alto el riesgo en tener un cáncer de pulmón.
And if they smoke, there's a very high risk of getting lung cancer.
Hay otros factores menores, genéticos, que están en juego. Pero la realidad hoy en día, la mejor forma de prevenir un cáncer de pulmón es no fumar.
There are also minor genetic factors, but the main cause in order to avoid suffering lung cancer is not to smoke.
Y olvidémonos por un tiempo en cáncer de pulmón de la leche, de la carne, de los virus, and so on.
And let's forget for a moment about milk and red meat and other factors.
El cigarro, el tabaco es lo que produce mayormente cáncer de pulmón. Y ese punto hay que remarcarlo, porque si no corremos el riesgo que la población pierda la percepción de riesgo que tiene si fuma.
Cigarettes, tobacco is the #1 cause for lung cancer. And if we don't underline that enough, we might be forgetting that people are not aware of the risk if they start smoking or if they smoke.
Esto como médico, como gobernante y conociendo estos temas y viendo la incidencia alta de consumo de tabaco que hay en el Uruguay y del número de cáncer de pulmones, no nos quedaba otro camino ético más que luchar fuertemente contra esta pandemia.
I've said this as a medical doctor, but as a government representative, of course we saw the high consumption of tobacco in our country, the high numbers of incidents of lung cancer, so we had to do something against it.
En Uruguay se consume o se consumía tanto tabaco como se consumía en los países del mundo desarrollado. Hay un mapa que se ve el consumo en Estados Unidos, Canadá, Europa, Asia, y Uruguay estaba al mismo nivel de consumo de tabaco que estos países.
Uruguay used to be at the same level in tobacco consumption like all the developed countries like the US, Europe, Asia. This was what we had in the past.
Y por tanto teníamos una alta incidencia de cáncer de pulmón igual que los países del mundo desarrollado.
And that's why we had the same high incidence of lung cancer like all the developed countries.
Pero también otras patologías crónicas como infartos agudos de miocardio ocasionados por el consumo de tabaco.
But also other chronic diseases like myocardial infarction.
Bueno, cuando tomamos las medidas.
Una pregunta más.
No, cuando tomamos las medidas, comprobamos una caída del consumo de tabaco bien importante en la población a lo largo de 5 o 6 años, sobre todo en jóvenes de entre 13 y 17 años.
When we took the measures, after 5 to 6 years, we already saw an important drop in the consumption of tobacco, particularly in the age range of 13 to 17 years.
Entre 2006, 2007 a 2015, el consumo de tabaco en jóvenes de 13 a 17 años cayó de algo más de un 25% a un 9%.
Between 2006 and 2015, in the age group of 13 to 17 years old, the tobacco consumption dropped from a little more than 25% to less than 10%, 9%.
En cuanto al impacto en enfermedades, pudimos medir el impacto sobre los infartos agudos de miocardio, que esa medición se puede hacer muy rápidamente en el tiempo, no medir el impacto sobre el cáncer, porque en el cáncer se precisa un largo tiempo de exposición al producto cancerígeno para que aparezca el cáncer, 15 o 20 años. Por tanto, todavía no hemos podido medir ese impacto, pero sí en los infartos agudos de miocardio.
The impact of our measures could be seen immediately in the acute myocardial infarction, so a drop in acute myocardial infarctions. This is something that can be measured immediately because the impact on cancer incidence can be only measured after 15 to 20 years. So you have to be exposed to the cancerogenous agents for a long time in order to develop cancer.
Y siendo Uruguay el país pionero en la región en llevar estas medidas adelante, fue la Organización Panamericana de la Salud, organismo de la Organización Mundial de la Salud, quien se encargó de controlar el impacto y cómo estaba actuando sobre las enfermedades. No fue el gobierno, fue la la Oficina Panamericana de la Salud y la OMS quienes controlaron la evolución para dar estos números que yo estoy dando.
And Uruguay, being a pioneering country in the region, our Pan American Health Organization, which is member to WHO, together with WHO, also started controlling the impact of our measures. So it was not Uruguay that controlled what impact our measures had, but it was WHO that did this job for us.
Y las mediciones de estos organismos internacionales mostró que en 5 años el infarto agudo de miocardio descendió un 22%.
And the measurements by these international bodies show that only after 5 years, acute myocardial infarction dropped by 22%.
Y establecieron que no había otra razón más que los que habían dejado de fumar que estaban evitando tener un infarto agudo.
And what was stated was that it could be for the only reason that people had stopped smoking.
Y lo más interesante fue que esta disminución fue muy marcada en personas menores de 40 años.
And this drop was even more noticeable in people under the age of 40.
But your attention, please. Sobre todo la disminución fue en hombres, porque las mujeres todavía están muy reacias a aceptar que el tabaco produce un daño tan importante en las mujeres como en los hombres.
This reduction was mainly obtained in men because women are still very much resistant to accepting the harm tobacco is causing to their health.
En mi país, mientras el consumo de tabaco en hombres va descendiendo y también aparentemente va descendiendo el cáncer de pulmón, en las mujeres el consumo de tabaco va aumentando y también va aumentando paralelamente el cáncer de pulmón en las mujeres.
And by my country, the consumption of tobacco by men has been reducing constantly ever since the measures have been introduced. Also, lung cancer has reduced, has dropped, but at the same time, the tobacco consumption by women increased, and also the incidence of lung cancer in women increased.
Hay estadísticas en Estados Unidos que muestran que en el año 1900 el 40% de las mujeres que morían por cáncer era por cáncer de mama, 1900. Y no se conocía en Estados Unidos el cáncer de pulmón en la mujer, en 1900.
US statistic says that in 1900, 40% of the women dying of cancer died of breast cancer. So they didn't know any incidence of lung cancer among women.
En la década del 20 del siglo pasado, la mujer comienza a fumar, 20 años después que el hombre, porque era muy elegante fumar con los pitillos largos, era muy chic.
In the 1920s, so 20 years after the men, also women started smoking because it became very chic, very elegant to smoke the long cigarettes with long cigarette holder.
Y cuando termina el siglo XX, en 100 años, la mujer cambió su destino oncológico.
And at the end of the 20th century, 100 years later, the woman had determined its oncology.
El cáncer de pulmón que no se conocía en la mujer, hoy está en segundo lugar de mortalidad por cáncer en la mujer en Estados Unidos. Muere por cáncer de mama y está muy cerca el cáncer de pulmón de las mujeres fumadoras.
So from not knowing any lung cancer incidence among women, 100 years later, the number 2 mortality cause is smoking. So it's lung cancer, the second cancer among women after breast cancer.
Más elementos objetivos y científicos que estos no pueden haber para demostrar que realmente el tabaco es un producto tremendamente nocivo para la salud, que se ha constituido en una pandemia brutal a nivel mundial y que todos tenemos la responsabilidad de trabajar para luchar contra ella.
I think there is no more objective and scientific evidence than what I have said to prove that tobacco is detrimental to health and that it's causing an international pandemic that we all have to fight against.
Porque además de lo humanitario, que es lo fundamental, la salud de la gente, la vida de la gente, también hay un tremendo daño en las economías y en las finanzas de los países para atender las enfermedades que ocasiona el tabaco.
So besides the harm that is done to health and life of the people in the countries, we also have to think about the enormous damages to the economies and finances of the countries.
Si evitamos estas enfermedades no fumando, el dinero que hoy destinamos para intentar curarlas lo podríamos dedicar para hacer más viviendas para la gente humilde, para dar mejor educación y mejor salud a nuestra población.
If we can avoid these diseases by simply not smoking, all the money that is spared from that can be used for housing projects, for needed people, also for better education and health programs.
And thank you so much for your attention. Yes.
Thank you very much for coming. We want you to all stay. We have more presentations for this press briefing from other countries that are doing the same thing that Uruguay has done, from Malaysia, Ireland, Australia, and some other countries. So please stay, and we'll get the last part of the press briefing started in about 1 minute. For the speakers, please come up to the podium and sit behind your place card. Thank you, Chris Martin. Nice to meet you. One of them, yes. Yes. Thank you for your patience. They moved your placard. All day.
Yes, I didn't know how to pronounce it. Very good.
Please. I had this.
Yeah. So I don't have much time left. Hello, Rocky, we have met. Yes, we met in Abu Dhabi. Yes, very nice to meet you. We met in Abu Dhabi also. Very nice to see you. Sorry we're late. No, it's such a shame.
Could you do the pickup first?
Absolutely. Absolutely.
Thank you for your patience. Don't feel the need to. presentations. We wanted to give you
So let's go ahead and move forward with the next speakers and presentations, please. My name is Carolyn Dressler. I'm a former board member from IASLC, a thoracic surgeon and very active in tobacco control, and so excited to hear the attention and what you've just learned from President Vasquez. But we have another wonderful set of presentations, and the next speaker that I would like to present is Dr. Vera Costa de Luisa y Silva. And she is a physician. She was the head of the World Health Organization Tobacco-Free Initiative, but right now, importantly, she is the secretariat for the Framework Convention for Tobacco Control. So she has been very active in local, regional, national, international, but it's now her leadership at the Framework Convention for Tobacco Control that we've asked her to speak now. Vera?
No, thank you very much. So good morning. It's a pleasure to be here with the press. You are the voices that make a difference in the implementation of the WHO Framework Convention on Tobacco Control. I have been very fortunate to speak in plenary after President Vasquez, and in fact his speech also conveys the message across on what a country should do as a party to the WHO Framework Convention on Tobacco Control in order to curb the tobacco epidemic. So this is not an easy job. It needs political will. It needs a commitment from governments, from the civil society, from the different organizations. And we can see an example in this World Conference on Lung Cancer on how an international gathering from specialists can contribute to prevention of the disease they are addressing in their global gathering. As you have seen, the World Conference on Lung Cancer is pretty much discussing new treatments, new avenues to provide some relief to patients of lung cancer, and eventually to go beyond the relief, but to treat them in such a way that they get cured from the disease. This is possible sometimes, but on other times it's more difficult. This is a very it's a very demanding disease. It provokes lots of suffering, and if there is something that we can do is to make prevention of lung cancer, like preventing coronary heart diseases, respiratory disease, and a number of other diseases. So the global response to this process was the negotiation and adoption of the Framework Convention on Tobacco Control. This is an international treaty that has now 180 parties who are legally bound to it, as they domesticate international law into a national law. And Austria is party to the treaty. Like Austria has all the commitments to implement the European, as a member state from the European Union, the European Union Directive, and all the different regulations on the tobacco directive from the EU. I think that the treaty is moving very fast forward in terms of implementation, but we have a big obstacle that is the tobacco industry. The tobacco industry is everywhere, like omnipresent, trying to influence governments, to influence associations, to have front groups, to avoid regulations and to avoid implementation of sound tobacco control measures. I had a sort of I had the luxury, let's say, of participating in all this process of negotiation of the international treaty until such a time I became now the head of the convention secretariat. And I can tell you that while we have progressed a lot, there is still much that we we have to do. So I think that we have to look into the potentials for not interference of the tobacco industry, not only in the government sector, but also in the different universities not receiving funds from the tobacco industry, not just using the pension funds to promote the tobacco industry market, not accepting funds from the tobacco industry to fund research. That usually is misleading and is usually prepared to confound the public and also to bring misleading information to the decision makers and policy makers in the society. I hope that soon every country in the world is totally free from tobacco smoke, that we don't find any lobby at any hotel or any bar where people smoke and impact on the health of non-smokers, especially waiters and the people who are working in these establishments, that we have tobacco prices as high as possible so that young people don't take up the addiction, that we don't have flavors in tobacco products, so the tobacco smoke is harsh and it's difficult to be inspired, and that we are able to denormalize tobacco use, not publicizing it, not promoting it, not bringing it in any society. So this is the message I wanted to give to you, and I hope that next time that I visit Austria, the lobby of my hotel doesn't have smoke of tobacco, that the lobby of the hotel is absolutely smoke-free, as it belongs to a country like Austria, a developed and wealthy country that has such a track record in so many aspects of human rights. Smoking is not a human right. Smoking is an addiction, and there is not such a thing as having the decision to smoke or not. We have to provide societies with all the elements for the future generations not to die from lung cancer. Thank you. So I have to run away because I have to go to the airport. So if you have any question, I would excuse myself from the Nobel group. Sorry.
Questions?
Yeah, if you have any questions for me, I would kindly ask you to make them.
I was wondering, also from the Netherlands. We heard from Malaysia the problem of the trade agreements that are many more than the Pacific. Is your framework somewhere involved in those negotiations?
So one question, where are you from?
The Netherlands.
You are from the Netherlands. So it's not my framework convention, it's our framework convention, because Netherlands is also party to the framework convention on tobacco control. This is a discussion that has taken place at the Conference of the Parties that has recently happened in Noida, India in November this year. And there is a decision already as an outcome of the conference in regard to trade aspects. There is this last COP was probably one where the influence of the tobacco industry was higher from the point of view of parties bringing people from the trade area who are used to trade negotiations and were really blocking a consensus on the measures, even on settlement of disputes when it comes to trade aspects. I think that is an evolving discussion, and we hope that when it comes to negotiating trade agreements, that tobacco is carved out as a product, as a commodity, and that tobacco use has the only and single approach as a public health issue that needs strong protection from governments and from intergovernmental organizations around the world. So I think that I know that Netherlands Netherlands is facing as well an issue of the interference of the tobacco industry. Like in many other places around the world, this is not a privilege from any country, but I think that we have to move on our agenda in order to make sure that when it comes to discuss trade vis-a-vis health, health always comes before trade and not the opposite way around.
My question is about the e-cig. Last week in England, but in Italy they already sold it. Philip Morris launched this new e-cig with tobacco, not with.
Yeah.
What do you think about it?
Well, you know, the industry is launching a number of new products in the market, and in the same way that in the 80s they came up with the light cigarettes that had no effect in terms of reducing the risk and reducing the damage of tobacco use. Now they are coming up with new products because the public health concern is increasing around the world. So we have to be very careful in the way we buy this the advertisement from the tobacco industry. They are not sort of industries that one can rely on, just the opposite way around. And they announce more and more products around the globe, from electronic nicotine delivery systems to tobacco, just this product that has tobacco but that doesn't have the smoke, so in such a way that they try to take care of the concerns that are arriving from the public health side. We have to be very careful. The Framework Convention on Tobacco Control is, and the Conference of the Parties, which is the governing body of the Framework Convention on Tobacco Control, is discussing this. And in general, the approach from governments is that all these products need to be regulated. They cannot be left at their own in the societies. They need to be regulated in order to protect the consumer. So I think I'm done.
With the tobacco trade negotiations and trade issues. So Dr. Zahn?
Thank you very much, Dr. Dressler. So I will be speaking on free trade agreement threatening public health, which is something that I've already touched on during the plenary just now. Just a little bit on, of course, the objectives of free trade agreement is to liberalize and facilitate trade among parties, and this is done through elimination of tariffs and non-tariff barriers. Now, I wish to just use the Trans-Pacific Partnership Agreement for the very reason that I was very much involved in getting tobacco issues addressed during the TPP negotiations. Now, there may be questions about why the Trans-Pacific Partnership Agreement, now that perhaps it may not come into effect at all because maybe the United States will not sign on to it because the current president-elect is not agreeable to it. Now, but still, the TPP is very important because it is dubbed as the 21st Century Free Trade Agreement, and it is the template for future trade agreements. And I think the EU with ASEAN and EU with other countries, even bilaterally other countries that will be discussing free trade and investment agreements might look into the text of the TPPA in crafting up their trade agreements. Now, in the TPPA, we know that there are a lot of very problematic provisions in the TPPA that would be challenging the provisions of the FCTC. We have heard from Dr. Vera just now that the FCTC's main aim is to curb and control tobacco, but definitely free trade agreements like the TPPA is objective is completely opposite to what the FCTC wants to do. In the TPPA, tobacco is carved out, but it is only partially carved out. It is not complete. During the process of negotiations of the TPPA, Malaysia proposed for it to be completely carved out. That means all the chapters within the TPPA should not allow tobacco to be given any privileges, because it shouldn't be as one of the goods that goes into that free trade agreement. But finally, the final text of the TPPA only carve out tobacco from the chapter on investment, that is the investor-state dispute settlement. Although there is a carved out from the ISDS, or investor-state dispute settlement, in other words, for any situation where the tobacco industry feels that tobacco control is causing problem, or whatever the country is doing is causing a problem for their trade on tobacco, the industry cannot sue the government directly. But it doesn't mean that the tobacco industry cannot do that through other means. They can still challenge the government on the whatever proposal or action on tobacco control that the government wants to do, through other means like state-to-state its dispute settlement. Like what happened, maybe Browning will talk about what Australia has experienced on the plain packaging. The tobacco industry could also do that, even with the inclusion of exemption of tobacco from the ISDS. Tobacco is very unique. It is highly addictive. It causes very serious debilitating morbidity and kills half of its users. So tobacco should not be treated like any other goods. It must be removed completely from all free trade agreements. Now, what I'm asking is for everyone, even physicians, pulmonologists and everything, we all have a role in making sure that our countries, when they negotiate free trade agreements, we should be consulted, or at least if they're not consulting us, we have to be making our voices heard, so that the government must be always sensitive about what tobacco industry could do by using the the free trade agreement to trump the FCTC. I think that's it. Thank you very much.
Do you have questions? Do you have any questions for Dr. Zhang?
Yes.
I was wondering if the United States will not go on with this trade agreement. Will that improve the situation, or will it be worse?
Well, at least as far as the TPPA is concerned, we're happy about it. And the fact that it is the partial carve-out is in the text, it has promoted other free trade agreement negotiations to consider carving out tobacco. If I'm not mistaken, the Australian-Singapore free trade agreement has that in it. So as far as tobacco in the TPPA is concerned, even though it's not going to be implemented, it becomes a precedent for other free trade agreement. Now, the question about whether it will make things better, I don't really think so. I mean, with the United States not being in the TPPA cannot take off, because the provisions for the TPPA to take off, it has got to be at least 85% of the GDP of the countries that started the TPPA. So it will not go on. But because the TPPA is a gold standard, it will be used by other negotiating countries or negotiating parties or group of parties to use the TPPA text or as a template for their discussion. So it's still a worrying thing.
Yes.
What kind of subjects could be part of this of a regulation that could be sued by the tobacco industry under TPPA?
There are many. I've got here at least 1, 2, 3, 4, 5, 6, 7, 8, 9, but there's a lot more. At least there's 9 here. Just give some examples. It is something that maybe people who are in the medical line will not find it very easy to grasp, because I really took a long time to understand this whole issue. Like, for example, the chapter on, say, national treatment and market access for goods. If tobacco is included in it, it has got to be treated like any other goods, so it should be subjected to tariff reduction. That means that you must get rid of all import taxes and so on. Unless, of course, the country then put in, because there shouldn't be any discrimination between imported goods as well as goods that is. So, but if the country has excise tax, then that may take care of it. But other chapters, like, for example, investment, investment on cooperation and capacity building and so on, where the tobacco industry is now part of the stakeholders. When I was in the Ministry of Health, when we come up with laws against the tobacco industry, I mean, the tobacco control law is against the tobacco industry, we don't get them into the picture. We would just then tell them, this is what we want you to do. But when they are in it, they can influence us, and because their influence is so great, they've got a lot of money, and they have access to so many people in government. The only, not to say only, but it could be the only agency within the government that is very much against tobacco would be the Ministry of Health. But they work with ministries of trade, ministries of agriculture, and so on. And it's easy for them to go through those ministries to get the tobacco industry, tobacco control laws not implemented the way we want it. So that is very problematic. So the provisions within the TPPA will require the tobacco industries to be consulted. This is some examples, and it is very, very conflicting with the FCTC, because FCTC Article 5.3 requires for government to protect health policies from influenced by the tobacco industry.
Thank you.
Okay, thank you. Okay, our next presenter is Dr. Luke Clancy. Dr. Clancy is a respirologist from Ireland. He has been in tobacco control from 2002, formally, but probably even before that. But the reason why I am so supportive of Dr. Luke Clancy is because he is actually instrumental for the first country in the world to go smoke-free in 2004, which was Dr. Clancy's work, along with others, but Dr. Clancy.
Thank you, sir. Thank you very much. I don't know if I've got very few slides, and I won't keep you very long. I'm delighted to be here, and it's a pleasure to visit this country, and especially this beautiful city. But it's very disappointing to see the status of smoke-free here. It's almost beyond comprehension to me to visit a highly developed, rich, educated, beautiful place, steeped in culture and art and music and everything we admire, and then to be smelling in one of the premier hotels of tobacco at this stage is very difficult to understand. And I don't understand it. It's hard to see it because we've seen that, okay, we were the first, but we weren't the first, we were the first country, but we weren't the first to talk about smoke-free, and many of the states, in fact, states that are bigger than Ireland, like California, were smoke-free. But this spread, we were the first in Europe, and if I showed a map earlier in my talk which showed that something like 13 to 16 countries had gone green, had stopped completely smoking in every area. And in that map, which I don't seem to have here, showed that Austria was lagging way behind in nearly every intervention in tobacco. And I heard somebody earlier asking the President of the Orchid, why did you do this so severe an intervention? What do they mean? He protects lives. He stops people having lung cancer. He stops them having heart attacks, strokes, dying of COPD, or even as bad, living, coughing and spitting and wheezing for 20 years. And she said, why did you do a thing like that? So is there something fundamentally wrong here? Or is the tobacco industry so powerful here that you don't see the rest of the world looking at you and looking at a rich, developed country in Europe doing so little when you could do so much and have done so much in so many other spheres? We have to look from outside and say there's something odd about this. So I'm going to just have one more slide, which is to remind you that, in my opinion, and what I already said today, is that tobacco control is everyone's business. It's not a few academics, it's not even this conference, which is very impressive to have so much about tobacco, with busy oncologists and thoracic surgeons who are spend all of their time at the coalface looking after these patients. In another way, it's easy to understand why they would be so interested in tobacco when they know that so much of the damage that they have to deal with is caused by it. But the other thing is that we don't have to work out how to take care of tobacco. It's well established, and you've heard about the Framework Convention. We know the interventions that work. For instance, price being the most important. Tobacco, 20 cigarette box in Ireland costs €11. We're not rich. We're not as rich as you. Why is it that it doesn't cost as much here? Because it is a revenue gatherer, it increases money for the state, which could be used to prevent tobacco, it stops people smoking, it reduces health costs, it does all good, and it costs nothing to implement, and yet it doesn't happen here to the same extent. So that's odd. And smoke-free is another one. That improves everything. The atmosphere, the notion about smoking being acceptable, which seems to be here, but increasingly in the developed world, it is not. And in Europe, it is not. Why is this that we still have to put up with it here as we walk these beautiful streets? And listening to the Vienna Boys Choir last night, I was just so exciting. And to say these people are growing up in a country like this that doesn't really seem to care. It doesn't try to denormalize smoking. It doesn't care about their future. So it's hard to visit and see all the beauty and yet see this blind spot with regard to tobacco. So I had to call today earlier on every member of this society to look at themselves, because we as doctors and nurses and radiologists and pathologists, we have a duty because we see the damage every day. You heard graphic description of it from the president of Uruguay. So we all have a duty to do something, and I have called on my colleagues to do something, and particularly to get people to stop smoking. All the other interventions are often at country level, they're often legislative, they're interventions that we don't influence too much unless we dedicate ourselves to this. So I put up a big list of things we've done in Ireland, such as smoke-free, but also like really expensive cigarettes, plain packaging coming next year, banning at point of sale. You can't see cigarettes anywhere, denormalized. And we've seen our children, which we had one of the highest prevalences in the world, I think, in children. 45% of our girls 20 years ago had had a cigarette in the past month. Now it's 8%. That is a dramatic change and is not an accident. It's because we've done what we know works. And I would really call on Austria to do the same. Thank you very much.
Do we have any questions?
I can hear you.
Okay. My name is Dr. Gaurav Kumar, and I am from India. And in our country, smokeless tobacco is a far bigger problem than smoking. And I'm wondering if, like, having smoke-free laws, tough smoke-free laws, they cause people to switch to snus or any other smokeless products, or there's no tendency like that. I mean, that's one of the things that I would like to know, if there's some data available on that.
I don't think it does, but one of the main reasons is that it's not available in our countries. Smokeless tobacco is not available. Although we've heard a little bit about AQUAS this morning, the tobacco industry are saying, we must have something that we could get these people addicted and so that their children would be enslaved and so that we can get more money, because it is money. They're probably not out to kill people, even though they kill half of their clients, our customers. But their main objective is to make money, so they will have alternatives. But in Ireland, smokeless tobacco was banned, so we didn't have the problem. And of course, they want us to use anything that will get us addicted and get our children addicted and cause them to die or to suffer while they're alive. But you have to have a comprehensive plan. As you say, there's no good in closing one door and knowing that there's a big window that's open. So when you're planning a comprehensive tobacco control program, you have your local pressure points. You must know what is the problem here and what will be the consequence of what we're planning, and if possible the unknown consequences of what we're planning. But it takes planning, it takes insight, it takes knowledge, it takes building capacity. You can tackle these problems if you know what they are. And I admire what is going on in India and what is happening in many countries, and now I believe in China as well. We're going to have something really dramatic, which I believe will change the face of smoking in the world. But here in Austria, they know very well what needs to be done.
Like the reverse is not true. I mean, from our experiences in India. I mean,
sorry?
Reverse is not true. Like if we ban smokeless tobacco,
yes,
it does not lead to increase in smoking. That's what we have seen there, based on ban on gutkha, in the last 2 years. It has not led to a rise in smoking at all.
Well, I wouldn't be overconfident if I were you. The tobacco industry are very powerful. If they feel that they're losing their profits, they will come at you. And they will find ways, unless there's action taken to limit their access. We heard Dr. Costa earlier about regulation. They need regulation. Don't assume that the Indians are not going to smoke. They will find ways.
Yeah, I mean, we had a sample size of like, say, 500 people from Delhi, and we didn't find even a single person who switched from gutkha to smoking after ban.
That's very encouraging. I wouldn't sleep on it if I were you.
I will post it there.
Thank you.
Thanks.
Any other questions? Thank you, Dr. Clancy. Okay, last but by no means least is going to be an innovative presentation that we didn't speak about earlier this morning that you'll be presenting on later in the meeting. But this is so very exciting because Dr. Brown-King developed this herself and has been bringing it internationally and has had, everywhere she's gone, people have just gone, what a great idea, and how do we implement it? She's a physician from Australia, and I'll leave her to present the rest of this terrific idea that she's having implemented around the world. Dr. King.
Thank you. Now that you mentioned how to do it, I have got the tricks of the trade here, so I can show you.
Is it, I don't know, did you, is it, yeah? So go back to the start?
Yeah, okay, we'll make it this one. That's great, thank you. Thank you very much for having me here. It's my great honour to present alongside some outstanding global leaders in tobacco control, so I'm thrilled to be part of this session. I know that this is a very long press conference, so I'll try to keep it very brief. I guess I'd like to start by explaining the story of why I'm here. I'm also an oncologist, and my story goes back to where I started my medical school, which was the University of Melbourne, and I graduated in 1999, and I graduated with great intentions. I wanted to do good things. I was a shiny new doctor planning to save the world, and the very first job that I was asked to do was to work for 3 months on the lung cancer ward at the Peter MacCallum Cancer Centre in Melbourne. It's the biggest cancer centre in the Southern Hemisphere, and like many hospitals around the world, the impact of tobacco is felt very keenly. That first 3 months, all of my patients had lung cancer. Nearly all of them were smokers or ex-smokers, and nearly all of them had started smoking when they were children.
And often we forget that. They don't get sick until they're adults. But in fact, adults almost never start smoking. And during that 3 months, despite living in one of the wealthiest countries in the world with access to the best medical care that anyone could hope for, nearly every single one of my patients died. And that's how I started medicine. And I can't really quite find the words to describe how disappointing that was. Everybody knows tobacco's bad, but when you see it right in front of you, every single day, the true impact, not just on the patient, but on the family, on the friends, on the community, it leaves an incredible impression on you, and I have never got over it. And I don't want to get over it. I want to use that experience to change things, because like the other presenters today, I feel that sentiment very keenly. Things have to change, because where we are right now is not good enough. 10 years after that experience, I was a specialised oncologist, and I had obviously continued to see the true impact of tobacco on people throughout that training period. Finally, I decided to buy a house, and my husband and I sat down with the accountant, and the accountant said to us, "Come on, you two, sort out your money. How much have you got in your pension fund?" And up until that point, I must admit I'd never ever even thought about pension funds. But like many countries around the world, Australia has a compulsory pension system. And without doing anything, as soon as you start working, your employer puts an additional 9.5% of your salary into a pension plan. And it's there until you're 65. You can't touch it until you're retired. And in Australia, we know about it, but there's not very much engagement between people and their pension funds. And so my accountant said to find out, so I did exactly what I was told, and I organised to have coffee with the representative from the hospital pension fund, the Peter MacCallum Cancer Centre pension fund. And I had a coffee with him at the hospital cafeteria, and he brought all his paperwork and he showed me how much money I had. And we had a nice chat, and I had a latte, and I shook his hand and I left and I walked away. Then completely as an afterthought, I came back to the table and I said, "Oh, by the way, was I meant to tell you what to do with that money?" And he said, no, you don't need to worry. It's completely taken care of. You're in the default option. And I said, "Oh, option, does that mean there are other options?" And he looked at me and he rolled his eyes and he said, "Look, there is this one greenie option for people who have a problem with investing in mining, alcohol or tobacco." And then there was silence. And I said, "Did you just say tobacco?" And he said, "Yes." And I said, "So are you telling me I'm currently investing in tobacco?" And he said, "Oh, yes, everybody is." That was March of 2010. And to cut a very long story short, I couldn't accept that. I felt that as a cancer doctor, that was an extraordinarily bad fit to think that I was an owner of tobacco companies. But that was how things were in 2010. Since then, I have founded an organisation called Tobacco Free Portfolios. I've got terrific support from the finance sector, health sector and the government sector, not just in Australia, but now globally. And I particularly want to thank the Union for International Cancer Control for providing seed funding and lots of support over the last year. The current status now is, if I can work this. No, that's gone backwards, hang on. We'll just jump to this slide. The current status now is that there are 35 pension funds in Australia that are tobacco free. And you might think that that's only one country, but Australia has a huge pension system. We have the 4th biggest pension system in the world, and this accounts for over 40% of our investors in the pension system in Australia. Next year, we will go over the 50% line, and tobacco-free will be the new normal. On a global level, this year, we were absolutely delighted to work with AXA, one of the world's biggest insurers, who announced a tobacco-free decision on the 22nd of May. In one decision, they divested €1.8 billion worth, sorry, that's billion euro, €1.8 billion worth of tobacco industry assets. In Australia, one of our biggest health insurers went tobacco-free last month. If we look at sovereign wealth funds, AP4, one of the biggest government-related funds in Europe, went tobacco-free last month. If we look at city councils, the Copenhagen City Council went tobacco-free a few months ago. If we look at fund managers, nearly all of the world's major fund managers that have a global outreach have created tobacco-free products to meet the new demand. So this conversation continues, and I think that we are at a really exciting point. So these are really the final comments here. Most workers globally are owners of tobacco companies. Most workers would not have any idea that that is what is currently happening today. Most sovereign wealth funds today invest in the tobacco industry. It makes absolutely no sense, and it in fact is something that is specifically referred to in the Framework Convention on Tobacco Control, and I'll be speaking more about that this afternoon. It's clearly time for change. If you invest in a company, you want that company to grow, you want that company to succeed, you want that company to find new customers, and you want that company to sell more of its product. And it's 2016, and it's time we all got together as a global community and asked ourselves if that is what we really do want for the tobacco industry. And finally, the momentum has started, and like some of my learned colleagues here, we know how to do this. I'll teach you on Wednesday morning how to do this. I'm having a workshop, and I would love for you to come, but I'm presenting this afternoon a few more tricks of the trade. I'm very happy to give these documents out and to teach anyone who wants to know, because also like Dr. Zane, I had to learn a new language. I'm an oncologist, I'm not a finance professional, so it takes a while to learn how to have this conversation and make sense and to be able to be part of the dialogue. But it can be done, and I hope that not just doctors and not just government officials will be really fighting the fight against the tobacco industry. I hope that it's the finance sector as well, because we need every single person to do their bit. Thank you.
Questions, please.
Okay. Congratulations. Just a question. Wasn't it Norway who was the big pioneer?
Yeah. Yeah, so actually with sovereign wealth funds, in fact, it was the New Zealanders. And see, I'm married to a New Zealander, and he always tells me they're very advanced. And on this particular point, he's right. In 2007, the New Zealand Superannuation Fund, their sovereign wealth fund, went tobacco-free. They were the first in the world to do so. The second in the world was Norway, and that was in 2009. And that was after the guidelines of the UN Tobacco Treaty, the Framework Convention on Tobacco Control, clearly articulated exactly what the specific provisions regarding investment meant. Australia, the Australian Future Fund, was third in 2013, and this year we've seen AP4, the big government-related Swedish pension fund, go tobacco-free. With my team, we're currently working with over 100 financial organisations now throughout the world, and about 15 of them are sovereign wealth funds. And the real reason the sovereign wealth funds are still investing in tobacco is because they don't know that there is a provision in that treaty that specifically states that if your government signed it and your government ratified it, which is 180 countries, your government is required to not invest in the tobacco industry. And really, it's like my colleague said before, we need our health ministers talking to our finance ministers. At the moment, they're a little bit isolated, and we can't afford to have that anymore. When I've had this discussion with the leaders of sovereign wealth funds, they've genuinely been very alarmed to find that there is a provision in a UN treaty that their government has signed that they are not adhering to. So it's a really interesting place at the moment for this conversation, but it's certainly got the attention of many leaders of sovereign wealth funds around the world.
Other questions? Thank you so very much. And thank you to the other speakers, and thank you for your patience in staying. Thank you. Please get the word out. Thank you. Yeah. Oh, where would you like it? Shall we come back and get that? Okay, yeah. We'll come back and get all.